Hi, my name is Vera Liu, and I'm here with Dr. Sylvie Wellhausen, and today we're going to be talking about health assessments for children. So, Dr. Wellhausen, the first question we have is, at what age do you recommend kids get their first blood work?
If they're not complaining from any particular conditions and if they're just healthy overall, I would probably not do labs until they're like 8 or 9 years old.
Okay. And what labs would you recommend testing for?
So not too much different from an adult. I would just do a CBC, making sure they're not anemic, and a CMP where you check their liver, their kidney, you check their liver enzymes. And unfortunately, I've seen children 10 years old with fatty liver, so we do need to check for that. And I would check for an A1C, not for all children, for children that I suspect have sugar and like an insulin resistance. So I would check for an A1C. Of course, I would check different nutrients too. I would check for their vitamin D, because it's hard to know, to assess how much time, especially now children are spending all their time in front of their screen. They're having an average of 10 hours screen time. So
yes, so much.
So much. So their vitamin D, I wouldn't be just limiting to that, because I would like to test the B12, the folate, the magnesium. The best test for magnesium is RBC magnesium. And then I would check even the vitamin A. Like if the child gets sick a lot, I would check their vitamin A level.
Okay.
I would check any inflammatory markers if I suspected any kind of inflammatory process. So I think that would probably be it, unless there was a particular condition that required a particular testing.
Okay. And we talked earlier a little bit about what if a patient comes in who has a sudden change in their behavior that mom or dad has noticed at home?
So if there's changes, two things can be monitored. One is hormones. Of course, before puberty, you wouldn't be testing sex hormones, but you could still test like the adrenal hormone, cortisol, and all that. The other that you could do is assess if you're suspecting any toxic metal toxicity. So of course lead, and you could do a hair analysis for this.
Okay.
So, and blood, depending on what you're suspecting.
Okay. We have a furry friend joining us as well. Thank you for sharing. Can you talk a little bit about functional medicine and testing for learning disabilities?
Okay, so for children, it wouldn't be just lab testing. It obviously would require a physical exam. So if we thought I would be assessing their gait, I would be assessing the way they look at us, do kind of a general health and mental assessment as well. And if I thought there was some more learning disabilities, I would do more specific testing for certain fatty acid. I would check the ratio of the omega-3, omega-6. I would check the coenzyme Q10. All of this that affects the learning. So, and of course their spine. Since I'm also a chiropractor, I would also make sure that the gait is not being affected by the spine, and they don't have aches and pains. And again, you see autoimmunity in children too, so we would be testing sometimes for those. But for learning disability, they do respond mostly to, I would say 80% is diet.
Okay.
So
yes,
nutritional assessment even through the lab is a good. And we also have this antioxidant scan at the office that tells them, okay, are you eating any fruits and vegetables? It's pretty accurate. It actually tests for the carotenoid family, but it's a good window to say, okay, how much fruits and vegetables is the child eating?
Kind of like a good pulse check.
Yes, it is.
Okay.
And it's actually such a cheap test. It's only $25, and it really tells. It's an amazing test. So.
Wow, that's great. Those are our main questions for today. Do you have any last thoughts for parents who are thinking about bringing in their children?
Yeah, I think don't hesitate to just do a good physical assessment for your child, because we can do a lot of time parents say, well, there's not much I can do about it. It's not much, this is my child, and but you can. Within 2 months, you can change basically the biochemistry of your child.
Wow.
So you can.
That's great.
Think about it. Your child, especially with food, and we'll do another little video on food for children. But the food they eat, the 1.5 pounds, 2 pounds of food they eat, those are molecules. So those are important. So this is going to be our next topic. So thank you so much for joining us today, and thank you. For being here.
And that's the end of our chat for today, but thank you for joining us. And if you have any more questions, please check out the Wellhausen Institute, their website, which we'll link below as well. Thank you.